I was easily addicted to pain pills. I had a lot of criminal history before I actually went to prison, wrote a lot of bad checks, and it was connected to my addiction to pain pills, and that's the reason why I wound up in prison.
I was in a bad relationship with my husband, got divorced, got with the wrong crowd and started making wrong decisions. A weekend thing would be okay, and my weekend thing turned into an everyday thing. I ended up losing everything that I ever owned. And then I got with, another man and got in trouble and went to prison, stayed there for 5 years, and a really long bid.
Doing its part to help tackle the opioid crisis, the Virginia Department of Corrections launched the Medication-Assisted Treatment Reentry Initiative in 2018 to help offenders and probationers with a history of substance use disorder overcome their opioid dependence.
The concern when someone is releasing into the community is that during their time of incarceration, they were most likely not using substances. Therefore, their brain chemistry has changed, and they restart using the substance of choice. They'll probably go back to using the same amount that they used when they came in being incarcerated, and their body's not used to that dose any longer, so it will have a greater effect on them and might lead to overdose. Opioids have different effects on the brain, but when it comes to our focus when talking about opioid use disorder, they would increase dopamine. And dopamine works in what we would call the reward center and, makes things more pleasurable to have more dopamine. In someone without a substance use disorder, their regular everyday activities that can actually increase your dopamine, exercise, pleasurable food, romantic interactions, all different kinds of activities that, normally a person can find pleasurable. The other issue for offenders with substance abuse disorder who are releasing to the community is that they may not have the same resources that others might have available to them. They may not have good housing or any housing. They may not have a stable job. They may not have a community of support, be that friends or family that can help them in other ways. That leads to other difficulties with staying away from their substance of choice.
My addiction is through my mind, and the reason why that I was still addicted through prison was because I didn't want to change my mindset. I still had that addictive behavior, and I wasn't ready for change when I got to prison.
There are currently 3 FDA-approved medications available to treat opioid use disorder. Methadone and buprenorphine, also known as Suboxone, are both agonist-based medications and work by stimulating the opioid receptor to decrease cravings and withdrawal. Vivitrol, or long-acting naltrexone, is an opioid antagonist and works by blocking the effects of opioids.
So Vivitrol is a long-acting form of naltrexone that blocks the opioid receptor. So that means that when someone uses an opioid, they would have no effect from that opioid. Vivitrol is just one component of the treatment. There are other components such as peer support and mental health treatment to go along with the medication.
The medication-assisted treatment program has been around for quite a while through the local CSBs, working with individuals who have opioid problems. The DOC implemented an MAT program to work with individuals who are getting out of the DOC who have been assessed having opioid addiction. And as a recovery support navigator, what we do is we identify these individuals and work with them while they're inside the institution to help them make easier transition out in the community by making sure they have the services they provide that are provided by the CSB, and to ensure that they have the things they need when they get out. For example, we could possibly help them find jobs and stuff like that. And we work with the families as well to ensure that the transition is smooth for them and there's no stress or anything like that would make them want to go back to using opioids again.
Well, I didn't want to do it because it was an injection and I was scared of it. But a young lady came from drug court and they had a panel discussion, and I just decided to that I wanted to change my life and I wanted to do something different, and I found out that you couldn't get high off of it, and that was something that I also didn't want to do anymore. So I just signed up for it and I tried it.
What appealed to me about the MAP program was the whole counseling and having support. Like Mr. Sizemore is really in my corner. He supports me on every decision I make. He makes sure I, get to all my groups, and he's always there for me if I just need to talk and vent.
My first client was Brianna Woody. Meeting with her, she was very serious, she was very focused, and she talked about how she wanted to, as she was going to be released, how she wanted to reunite with her family, how she wanted to start practicing self-care, investing back into her life and becoming the best person she could.
So when I first got my first injection, I really didn't feel anything. I didn't get any side effects from it. I guess it really hit me when I hit the streets and I started really focusing on everyday life without being high. And the MAP program has really helped me because the Vivitrol is really not the main piece of the program. The main piece of the program is support by your navigator, your PO, and the people surrounding you and your family.
My goals that I have reached in my life is I'm a full-time worker. I'm a manager at Subway. I have my license back that I got on my own this time. I have my children back in my life, and I have trust. My parents trust me, my children trust me, and that's something that I worked really hard to get, and I wouldn't trade that for anything.
I feel different, I feel new, I feel wonderful, I feel like a new person. I feel like me. I feel focused, living my best life.
I would tell somebody in prison getting ready to get out that I've been there, and I know what it feels like to go through the anxious and the anxiety and just the worrying about everything, because you have so many thoughts, and when you get out you want to succeed. Nobody wants to say, oh, I want to get out and do this all over again, So, and I would really encourage them to get on the Vivitrol because it helps 100%. It's helped me accomplish every goal that I have placed in my life, I have accomplished.
So the road to recovery for everyone is different, and it's always important when you're looking at new treatment to weigh the pros and the cons for yourself. But when looking at a program like medication-assisted treatment, I think it's good to just think of it as one more tool in the toolbox, and that this can be a difficult road, and making it just a little bit easier for yourself is never a bad thing. And so knowing that there are medications, there are peer supports, there are mental health providers out there to help you along the way is a positive thing.
If they're really ready for change, then this is something that really works. And it's not for everybody, because not everybody wants to change, but if you really want to change and you really want to focus on life, then this MAP program is where it's at.
To learn more about the Virginia Department of Corrections Medication-Assisted Treatment Reentry Initiative, contact your counselor or one of the recovery support navigators.